Thanks for watching this video. Today we're here with Skip Rizzo, who is a professor at the University of Southern California and absolute legend in virtual reality therapy. He's going to be talking to us a little bit about how virtual reality therapy has transformed over the years and give us a little preview of what he's going to be speaking at AnxietyTech. Thanks so much for joining us, Skip.
Thanks for having me.
Hey, well, why don't you introduce yourself? Tell us a little bit about your work and what you've been doing for the last 25 or so years.
You make me sound old here.
No way.
Anyway, but we started the VR Psych Lab back in 1996 at the University of Southern California, and that came on the heels of my years working in clinical service delivery in brain injury rehab and anxiety disorders, and was very frustrated in the early 90s as to what we could do in the field in terms of technology. And then I started to implement gaming applications with my folks with traumatic brain injury.
Right.
More about virtual reality. And, you know, as you may know, the early to mid 90s was the initial renaissance.
The first heyday, right? Of virtual reality.
The first overhyped period.
Yes. We may be in our second one now.
Yeah. And so I got real excited about VR, and I saw Jamund give a presentation in '93, I think it was.
Wow.
And all right, this is what I want to do. I want to bring, VR simulation technology into brain injury rehab and anxiety disorders. It was well matched to what the clinical application needed. And so I ended up leaving clinical work in order to set up a lab at USC, make friends with computer scientists, because back then it was very expensive and complicated to build VR worlds.
Yeah.
And I got lucky, and I met a couple of really good people in computer science. And starting in 1996, we started building things and actually doing good scientific research. That actually coincided with the birth of the nuclear winter of virtual reality. It was around 95, 96. VR fell out of favor, and legitimately so, because the hype was so overamped.
Right.
Technology was just not mature enough to deliver good user experiences. So, but the vision for applying it for clinical purposes, especially in anxiety disorders, was sound. And so myself and, maybe 100 people around the world carried the torch.
So you kept going through this period where everyone said, it's not ready, it's not real. You kind of kept plodding along. How did you manage to do good research during that time when obviously the interest had lowered a lot?
Yeah, well, people did have equipment, and sometimes it wasn't that good, but some of the stuff was halfway decent. And one of my first projects, I had access to what was called an Immersidesk, which was a 3D projection system. Looked like a big drafting table, and it projected 3D imagery like holograms in space.
That's awesome.
It required a $200,000 Silicon Graphics reality engine, $30,000 of electromagnetic tracking, and all this stuff. But we ended up building a bunch of visual spatial applications that lended themselves to doing basic science testing as to whether we could change cognitive functioning with hands-on practice in a 3D virtual environment. And that's what we did. We published a number of studies with mental rotation, showing significant improvements in a person's cognitive ability to do these visual spatial challenges that were thought to be kind of hardwired or very hard to learn. But doing it in VR and interacting like sort of an embodied cognition fashion, significant improvements in very brief periods of time. So that got us going. And it wasn't until
kept the momentum. Yeah.
I started playing with head-mounted displays. We built a virtual classroom for testing kids with attention deficit disorder. And it was very primitive, but all of a sudden we're finding out that, by putting children in a simulated environment and systematically manipulating the stimuli, we could begin to get better measurement. Anyway, make a long story short, the technology incrementally improved over time. I think what we saw around 2012, 2013 was tipping points in display technology, in computer graphics, in computing speed, in various tracking technology, in AI. All these things all came together to make it so that now we're at a point where we can build, VR simulations pretty readily. We can build complex
that really work and are effective treatments. I mean, what sort of treatments? I mean, I know you do a lot of stuff with PTSD. What are all the sorts of treatments and stuff that your lab works on?
We've done a lot of work in the rehabilitation space, tracking user movement to that user in a game-based physical therapy or occupational therapy environment. Awesome. We've done a lot of that. We've done the cognitive work with testing attention, memory, executive function. We've got a couple of grants now trying to train attention in VR simulations, particularly with children with attention impairments. We've done a lot of stuff with spherical video, social phobia applications. We built, virtual parties, virtual job interviews, social skill training things. But the PTSD work is probably what we're most known for because it has gone on since the idea gelled in our lab in 2003 and then incrementally continued to evolve and generate good research documenting the efficacy of applying VR as a tool for exposure therapy.
Awesome. Here's my question. Do you think we'll see in the future that with virtual reality and other technology that therapy will come basically into your home, so you can just be in your home to get the treatment that you need rather than needing to go out and seeing specialists? How do you think these technologies will transform the way people get therapy?
I think that we have to look at it from two perspectives. One is we want to break down barriers to care and provide more accessible options for people to get the treatment that they can benefit from. Right. That's number one. But number two is a lot of times it's essential, and I think most of the time it's essential that there's a clinician, a well-trained professional in the mix doing a proper diagnosis, right, so that the treatment is informed to address a real problem, not something that somebody goes online and reads about and says, oh, that's me, I've got that problem.
Yeah.
Load this software and fix myself.
Not quite there yet.
No, I'm very cautious about that. That doesn't mean that patients can't independently use this stuff, but I think it needs to be under the guidance of a clinician. We're still doing good clinical care here. Right. We can eliminate the clinician's role in the process. Now, we're already seeing things that are freely available to patients, like fear of public speaking. Mm-hmm. There's 20 of those kinds of applications that you can download. You can run on a Gear VR, or Oculus Go, or any of these standalone type headsets. And in the clinical domain, we kind of give that a pass because, everybody's got a little bit of fear of public speaking. It's a skill that can be learned.
It's not necessarily a disorder or something really, that needs clinical treatment necessarily.
Yeah. It is still officially, an anxiety disorder if you reach certain criteria. But certainly over the years, people have taken public speaking courses, not run by clinicians, more as skill training. So we give that a pass. Mm-hmm. But starting to see fear of heights, fear of flying. Some of these applications are now popping up that I have concerns about because I think you really need to have an informed diagnosis from a professional when you start to move up the anxiety disorder scale of things that could be really impactful for a person's life. You don't want somebody to think there's a shortcut and they can just download this VR thing and do it for a day and then they're fixed. Yeah. When the problem goes much deeper and they're not getting the benefit of actually talking to a clinician and digging down into what the real problems may be.
Right. I can relate to that. My wife isn't here. She usually comes on these videos, but we've had experience doing cognitive behavior therapy and exposure response prevention for her OCD. And definitely understand, you have to work with a therapist. You can't just kind of say, oh, I'll just do this one little thing and I'll be all fixed. You actually have to get make sure the people that are giving you good information so that you're getting the real help that you need, and understanding like getting better is a long process. No matter what you're dealing with, it's a process. It's not a quick fix, unfortunately. I mean, it's just reality.
Certainly. Now, with that said, we are building applications that patients can use between sessions to help them do exposure therapy for places they've been avoiding, particularly with PTSD.
That's
where you sit at home, a mobile phone enabled headset like a Gear or a Daydream or an Oculus Go. And I think those things can supplement. Yeah, those things can supplement what's done in the session. So I'm not negative about independent use or practice by patients, but I really feel at this point anyway, you need to have good informed clinical judgment to guide the therapy. But we're seeing a lot of good stuff being done in the cognitive behavioral front with good psychoeducation, good highly manualized CBT stuff that can be done online. So I'm optimistic that we can break down barriers to care. It's you don't have to have $10,000 worth of equipment to be able to do this. You can do it in the home. Perhaps we can break
the technology improves so rapidly. It's absolutely amazing. So are you generally using off-the-shelf technology, or do you have custom technology that you're building? You're just kind of following along with the latest Oculus or latest Samsung stuff? How do you get your hardware?
Well, certainly it doesn't pay for a university research lab to reinvent the wheel with minimal funding. So we're not building headsets. We're not building augmented reality. We still build a little bit of tracking technology ourselves. But for the most part, as far as the equipment goes, we pretty much, use consumer grade equipment. However, there's certain software things that we have been developing over the years that, that aren't quite the research grade tools that test something that hasn't been developed so well in the commercial sector. And this is particularly in sensing the user's facial expression, vocal prosody, gestural behavior when they're interacting with a virtual human interviewer. So we do a lot of stuff with AI-infused virtual humans. And we want to sense the user's behavior automatically to inform the virtual human about the user's anxiety level or level of confusion or frustration. So we've developed specialized software in that area. But whereas 10 years ago, we had a group in our lab that was developing voice recognition technology, that's stupid to do now. You've got all the majors building voice recognition and with significant funding. So you've got to pick and choose what you need to develop in order to evolve something. And so you do it judiciously, and you want to use equipment that's readily available at Best Buy or,
so you can get it into the hands of people very easily and hopefully inexpensively, I guess.
Yeah.
Awesome. Well, hey, let me kind of wrap things up here a little bit. Skip, it's been amazing learning about what you're working on. I'm super excited to hear more about your research and sort of the future of virtual reality therapy at the AnxietyTech conference. Any last thoughts, any things about where kind of virtual reality therapy is headed?
Well, I think it's got nowhere to go but up. Finally the technology's caught up with the vision. We can do things really well. We also have, particularly in the anxiety disorders literature, the largest scientific literature of pretty much any VR use case. People have been doing the research. So we've got good theory, we've got good research to support the use of these things and the continued evolution. So I'm pretty excited about what we're going to be able to do in the future, because anxiety disorders and depression are, real serious public health issues. And I'm pretty excited about AnxietyTech specifically because as I look at the schedule, I'm seeing some really innovative thinkers that have their heads screwed on right to talk about a wide swath of technology and infused applications. It's going to, I think, move the needle forward in advancing healthcare in this area. So I'm excited to be a part of it. I thank you for inviting me.
Thanks so much, Skip. Yeah, join us July 18th at the Palace of Fine Arts Theater in San Francisco. More info at AnxietyTech.com. Thanks so much, Skip. It was an absolute blast talking with you.
Pleasure.